There are multiple factors involved in one's wellness that influences health. A person's environment, occupation, and finances are all factors. Sometimes a person may find it difficult to have a positive influence in many of these areas. There are factors that can end up hindering a positive outcome for some people. Many people are able to support their wellness through acknowledging where their health is and acknowledging what their body needs to encourage a positive outcome for their health. On the other hand, some people may be challenged in their wellness and create negative health results. This is something we should all recognize to encourage the positive outcomes. Social practices are a part of the 8 dimensions of wellness. Being able to form lasting relationships and understanding how social practices affect wellness is extremely important to ensure health. In our society, promoting a healthy lifestyle is incredibly important to be able to combat our national health problems. In more recent times, promoting healthy eating and physical activity, along with mental health, has begun to help our society. As a home health attendant and future healthcare manager, promoting wellness and health influences many in my area because keeping our clients healthy and safe is number one. No matter who you are, you will experience many challenges to wellness, but you may also experience support. Mobile, games, and applications are all types of technology that are being utilized to improve health and wellness. The results are inconclusive now, but these technologies allowed individuals to keep up their health and wellness easier than they did before. Understanding what could help support or what challenges our wellness is an important issue when it comes to understanding your own wellness. Throughout our country, one large challenge to our society's wellness is substance abuse, and in more recent years, the use of heroin alone has become an epidemic. Opium dens were very popular throughout the late 1800s, and it was used as a cure for alcoholism. Opium was also what was used to create morphine, a pain reliever, in 1810, which soon became an epidemic in itself, which went unnoticed until after the Civil War. It was used to treat soldiers, which turned many of them into addicts. By 1874, the problem was noticed and the answer was found in a new drug. In Germany, heroin was created and imported into the United States as a safe, non-addictive substitute for morphine. Heroin, morphine, and opium went unregulated until the 1920s when the Dangerous Drug Act was enacted. By 1925, it was estimated that over 200,000 heroin addicts existed. By 1995, it was believed to be underestimated, that 2.4 million people had used heroin in their lifetime. There are multiple types of people that are at risk for using heroin. Heroin use is on the rise and knows no demographic, whether it is income level, gender, or age. The largest risk group is non-Hispanic white males aged 18 to 25 living in a large city. The largest increase in use has been seen in the age group 18 to 25 and in women. As heroin use increases, so does the rate of overdose. Between 2002 and 2013, overdose deaths related to heroin use increased by 286%. It is important to understand that a person addicted to heroin is also most likely addicted to cocaine, alcohol, or prescription pills. People who are addicted to opioid painkillers are 40 times more likely to be addicted to heroin. The heroin epidemic, along with substance abuse in general, can become an incredible challenge to a person's wellness. Being addicted to heroin can cause multiple health problems in the short and long run. Short-term effects of use include, but not limited to, euphoria, weakness, and slowed breathing. Long-term effects include addiction, infection, pneumonia, and death. Heroin users develop a dependency and tolerance to it, which in turn makes them use larger amounts of the drug. The more they use, the more likely they are to overdose. Everybody has the ability to help impact the heroin epidemic. It is important for the government, doctors, and everybody else to come together and combat this epidemic. Educational training for healthcare providers and individuals interested in learning more would be a great step. Expanding programs that help assist people get the proper medical help they need could help prevent people from self-medicating, as well as making prescription opioids a last resort for doctors. Also, individuals learning the signs of addiction as well as being able to recognize an overdose and how to respond to such an occurrence. Federal and state government would need to come together with physicians to work on this problem. If they cannot work together to find a solution, then that would leave a negative impact. The strategies that could be used to help inform doctors, nurses, and the general public about the causes of addiction and the ways to combat it, as well as helping those addicted to find the best course of action to get help. The smartest way to implement these plans would be for Congress or federal government to address this issue. After Congress is able to address this issue, they must propose a bill to implement expanding rehab and medication programs. Each state must also address this issue to assure their citizens that it is being taken seriously. It would also be important for the government to make healthcare providers responsible for identifying individuals with drug addictions. If our government, healthcare providers, and citizens work together to combat this epidemic, it could take the terrible stigma people feel when reaching out for help. It could make the addict more prone to actually ask for the help and take it.